type of care. I'm just hoping that it sparks an interest and you all start to create a plan. If anything were to happen, your family would know what to do. So that's the purpose of this presentation. That's why I'm here today. So what is long-term care? Well, according to the National Institute on Aging, long-term care covers a variety of services designated to meet a person's health or personal care needs for a short or a long period of time. And these services help people live as safely and independently as possible when they can no longer perform their activities of daily living or their ADLs. So if you are taking care of your loved ones at home, you are providing long-term care because it covers both paid and unpaid sources of support. Just because the term is long-term care doesn't mean that you have to necessarily be providing the care long-term, right? It also covers short-term care. So respite care, which is care when your primary caregiver is temporarily unable to take care of you, right? Or if you get an injury or incident and you're unable to take care of yourself, that is also considered respite care. That is a part of long-term care. So now that you know what is long-term care, let's talk about what is not long-term care. So affordable senior housing technically is not considered long-term care, okay? Because you have to be independent to get into affordable senior housing. And while it's not technically long-term care, they do have a wonderful, network of support there. The seniors in the long-term care communities support each other. I often do public speaking events at these affordable housing communities because I want to educate them about the benefits of transitioning to long-term care Medicaid, when they need a higher level of care. So it is a great resource, but technically not long-term care. What else is not considered long-term care? Independent living facilities. If you go into an independent living facility and you're not receiving any care, technically you can't use your long-term care insurance for that. But if you're in an independent living facility and you have home care start coming in to help you with your activities of daily living, you are now receiving long-term care. So it can get a little complicated. Oh, did I switch to the, okay, let's see. I switched over to the activities of daily living. I'm so sorry, I was still talking about long-term care. Okay, so what are activities of daily living? So these are things like bathing, dressing, toileting, ambulating, walking, transferring. If you've ever been hospitalized or in a nursing facility and you hear the nurses, trying to figure out how many activities of daily living you can do, this is what they're referring to. Okay, so instead of reading you definitions and answers of the different types of care, I want to paint a picture in your mind of the different stages in life that you could possibly go through and the different types of care that might be appropriate for you at those different stages in life. And so I want you to meet Jun and Ichiro Tanaka. Those were my grandparents. I like to honor them by including them in my slides and talking about them. But we're going to use Jun and Tanaka and say that they're healthy. They're around 75 years old. They work in the yard every day. They live alone. And we're going to say that their children are on the mainland, so they have limited support here. And we're going to follow them throughout the different stages in life and talk about the different types of care that they might need. When I started doing these talks, I used to read all the definitions and terms and give all this great information, but I would put a lot of people to sleep, so I'm not going to do that to you today. I want to make it a fun event. And I don't want to scare anybody today because I'm going to move Jun around a lot, but just know that most people don't move this frequently. They move into one type of care and they stay there their entire life, aging in place. Just for the purpose of this presentation, we're going to move her around a lot. So we're going to start with supplemental care in the home, right? These are support resources to keep you at home longer. We're going to start with home health services, and then we're going to talk about home care. There's a lot of confusion between the two, so hopefully I can clear that up for you today. Then we're going to talk about home and community-based services, and then we're going to discuss adult day care and adult day health and the differences between those two different types of services. Okay, let's start with home health services. So let's say June and Ichiro are outside working in their yard. They're very independent, very social, and June has a major fall. She trips, she has broken bones, she goes to the hospital, they treat her, and then they send her home, right? She was doing okay in the hospital. They send her home. At home, she's not doing too well. She's using a wheelchair. She's not walking around so much. Ichiro cannot get her in and out of the car. So she is now what's considered homebound, right? What is homebound? That means that it's taxing for you to leave the house. You're only leaving for medical appointments and necessity. Well, now that she's homebound, she's not back to her baseline. What does baseline mean? That means her level of functioning before this incident, right? She was independent, she was walking without any assisted device, and now she's not really walking. So I would recommend home health services to her. Home health is great. She could have physical therapists, occupational therapists come to her house to exercise her, to rehabilitate her, and get her stronger. And the goal would be to get her back to her baseline, right? So what are things to note if you are calling for home health services? Well, you should know that you're probably not going to be calling them directly because you need a physician's order for home health. So your first call should be to your primary care physician to ask for an order for home health. And something that I also want you to know is that I get a lot of calls from people that get sent home from the hospital and they call and they're frantic and I'm home health supposed to come, they're not here, they haven't called yet. It takes some time. They have to verify your insurance. They have to schedule the skilled therapist. They usually do not start right away. So you could be waiting a week or two for your home health services to start. But it's a great place to start because how do you fund this? It's a Medicare benefit. For everyone 65 and older that are eligible for Medicare, Medicare covers home health as long as you qualify. Okay? And how many options do we have here in Maui? We have 6 home health options. So everyone should have access to home health. I'm sorry, this thing is skipping forward. Okay. Next, I want to talk about home care agencies. So a lot of people are confused between home health and home care, but there's a big difference between the two. So let's say June finishes her therapy, right? She finishes her physical therapy, occupational therapy. She's walking again. She's not back to her baseline. Now she's using a walker. She's slowing down. She's afraid to get in and out of the bathtub. She doesn't want to have another fall. She doesn't really want Ichiro bathing her. So she calls her children in the mainland and they start asking around and they hear about home care. Home care would be great supplemental care for June at this moment in her life, right? She wants bathing service. So her family calls home care and says, hey, our mom needs some help. They might ask you, what type of care does she need? So I want to explain that to you today. If you look at Department of Health's website, they talk about 3 different services that home care has to offer, right? One of them is homemaker assistance. Homemaker assistance is light chore services, housekeeping, meal planning, meal preparation. Then they have personal care. I usually get calls for personal care. It's one of the most highly requested services. That's help with activities of daily living. So that's that ADL chart that we went over, right? Bathing, toileting, dressing, transferring, getting in and out of bed. So June would actually need help with personal care. And the last on the list is respite care, right? Respite care is that temporary care or relief. So if Ichiro had to fly to the mainland for a wedding, and he wanted someone to stay with his wife to take care of her, he would call and ask for respite care. So a lot of people call me on a regular basis and say, which home care agency takes respite care? It's sometimes hard to find. There's no magic agency. It depends on staffing, right? If the home care agency has excess staffing and they can help respite clients, they will. So it just depends. There's another type of care not listed on Department of Health's website, but I do get requests for it. It's called companion care, and that's where no actual care is being provided. Some people ask if companion care and homemaker assistance is cheaper than personal care. And you would think that it might be, but that's not always the case, right? Sometimes it goes by how many hours per day you're going to get home care. If you're requesting 2 hours per day, you might pay a higher rate than somebody that's getting 10 hours per day of home care, right? Yes. Yes, yes. So he asked if I can define respite care. That's a good question. So, respite care is temporary care or relief when your primary caregiver is unable to take care of you, or if you have a recent injury or illness and you have a lack of caregiver. So, let's say I break both my legs, I need respite care until I recover from my legs being broken. That's respite care. Good question. He asked if that's live-in care. So respite care can be provided by a home care agency or a facility like assisted living, care homes, nursing facilities. They all provide respite care. Thank you. Oh, yes. Thank you. Thank you. So how do we pay for our home care? Uh, Unfortunately, Medicare does not cover home care. Medicare covers home health, so a lot of people think home care will be covered, but it is not a covered benefit. Most people are privately paying for their home care services, or they're using their long-term care insurance. And just because you have long-term care insurance and you can use it doesn't mean you necessarily should use it, right? So for long-term care insurance, sometimes they say you must need help with 4 out of the 6 activities of daily living, right? But if you have a 3-year long-term care insurance policy and you're very young and you need help with some activities of daily living, you really should try to figure out a long-term plan, right? Maybe use your private pay money at the beginning. When you can't afford your care anymore, then you use your long-term care insurance. Then when you run out of that, hopefully you can transition to long-term care Medicaid, right? That's coming up with a full long-term care plan. And if you have Medicaid, right, you could benefit from home care. Medicaid covers home care, but you do have to qualify for that. So you have to call your Medicaid health plan, and then you have to ask them, right, who your health coordinator is. They will do an assessment and determine whether you're eligible or not, but it's a Medicaid benefit. And how many options do we have here in Maui? We have about 22 options here in Maui as far as licensed home care agencies under the Office of Healthcare Assurance. How do you get a home care agency? Good question. So for home care, you can call these agencies directly. You do not have to go through your primary care physician. You do not need a doctor's order for it. Okay? And it's possible if they have availability, they can start services same day. So you might not have to wait, right? So if you're waiting for home health and you need somebody to come immediately, you can call home care and have both at the same time. Yes. Oh, good question. What is the difference between Medicare and Medicaid? So when I was in social work school, I had to memorize the difference, and we all kind of memorized it by, Medicare is for everyone 65 and older, and Medicaid is for under income, right, or disabled. So you have to qualify for Medicaid, and I want you to know the 2 ways that you qualify for long-term care Medicaid. Everyone knows the first one, which is financial, the financial requirement, but some people don't know that there's a level of care requirement as well. I do get calls from families and they're spending down their money. They're spending $10,000, $15,000 a month on home care, and I ask them, what is your long-term plan? And they say, Medicaid. Medicaid will pay for my care when I run out of money. And we do a level of care screening, and they're nowhere close to meeting the level of care requirement for long-term care Medicaid. And we have to tell them, please be conservative with your money, okay? So if your plan is to spend down and use long-term care Medicaid, please check with a professional, have somebody do your level of care screening. These are great questions. And I do want to point out that we have experts here on Maui in the field that are going to be joining us on a panel for questions at the end. So home and community-based services. So let's talk about June again. June now has home care twice a week coming in for personal care to help her with bathing and activities of daily living, right? But now she's really slowing down. She stops cooking meals. So first she thinks of asking her home care agency. Maybe they can cook all our meals, right? But then they can't really afford to have a home care caregiver coming in every single day. They're on a fixed income. So what is their next option, right? A good option for them is home and community-based services, which are services provided through our federal, state, and county agencies. A lot of these services are free. Some of them are heavily subsidized. Some things to note is that there may be a wait list for some of these services, or you may have to qualify for some of them. But it's a good place to start, right? Because it's a lot of free and subsidized services, and they have all kinds of things like meal services, transportation, respite programs, daycare programs, case management. So if anyone has questions about these home and community-based services, you can contact the Maui Office on Aging and the Aging and Disability Resource Center. And they have a booth today, and they will be on the panel. I called them to check in with them before I did this presentation, and they make it very easy for everyone. They said if you can't remember who to call, you can just dial 211. 211, and they will direct you to them. And they are a no wrong door agency. I love that term. That means no matter what your needs are, if you call them, they're going to try to help coordinate care and services for you to get you to the right place. So if you don't remember anything about my presentation, please know that you could call this no wrong door agency, and they will help point you in the right direction. How? Oh, 211. 211. The Maui County Office of Aging and the Aging and Disability Resource Center. Yeah. Now let's talk about adult daycare programs and adult day health programs. This is our last resource we're going to talk about to stay at home longer. And we're going to say that June is now using her meal delivery service. She has a caregiver coming in twice a week. Her children come home to visit her, and they realize she's watching TV all day, all night, every day, doing the same thing. They think mom now has dementia. She's not going out of the house. She's not visiting with friends. She's rapidly declining, and they're worried about her quality of life. So now is a time for the family and for June to consider a day program, right? But which one is right for June? Should they go to adult day care or adult day health? And what is the difference between the two, right? These are programs, they both focus on socialization, activity, routine, but they do vary from program to program, right? Some of them will take people that are a fall risk, some will not. Some will take people with walkers and wheelchairs, some will not. Some will take people that have afternoon medications, and some will not. They vary from program to program, so you will have to call them, okay? And how do I fund this type of care? To the best of my knowledge, Medicare does not cover this type of care, so a lot of people are privately paying for it. If you have long-term care Medicaid, Medicaid does cover this type of care. So you have to, again, call your Medicaid health plan, talk to your health coordinator, see if you're eligible. They're going to do a level of care screening, but they do cover adult day care and adult day health. And what are the differences between the two? Adult day health has that health component. So you can think of it as a higher level of care, right? And because it's a higher level of care, these adult day health programs are often in skilled nursing facilities, which is the case here in Maui. So how many do we have? We have 3 adult day care programs, and we only have 1 adult day health program here in Maui, and it is in a skilled nursing facility. And I do believe that we have somebody that will be on the panel today to talk to you about that. Yes? 3 adult day care programs and only 1 adult day health program here in Maui. Yeah, thank you. Okay. What do we do when our loved one's care exceeds what we can provide in the home, right? Everyone wants to stay at home. as long as possible, age in place. Everyone says, not me, this is not going to happen to me, right? But should you ever need more care than what your family can provide, it's good that you know what your options are. So I do want to talk about it a little bit. I'm going to start with senior communities. I'll talk about the two different types of senior communities we have in the state of Hawaii. A lot of people don't know we have two types. And then I'm going to talk about licensed care homes. I'll go over the difference between adult residential care homes and community care foster family homes and the different ways that you could fund the two different types of care homes. And then lastly, I'm going to talk about skilled nursing facilities. There's a lot of confusion about skilled nursing facilities because sometimes Medicare covers it and sometimes Medicare does not cover it, right? So I explain this to families on a daily basis, so it's good that everyone knows when it's covered and when it's not covered, right? So let's start with the senior communities. So let's talk about June, right? June's been through a lot. She had some major falls. She had home care coming in twice a week, right? Then she had a meal delivery program, and then she was enrolled in adult daycare that she went to 5 times a week. And now we're going to involve Ichiro. So we're going to say Ichiro is also slowing down, and he stops driving. So he's no longer able to get the things that they need for the house, the toiletries. He's getting tired of maintaining the home. They are on a fixed income, right? So their money is tied up in their home. The children come to visit and they say, Mom, Dad, we want you guys to have a good quality of life. We want things to be easy for you. We want you to enjoy. We're going to look at senior communities, right? But which senior community is right for June and Ichiro? They're not too sure. Our state of Hawaii has two different types of senior communities. One are assisted living communities. The other are what we call CCRCs, continuing care retirement communities. So the continuing care retirement communities often have a buy-in, right? It's like buying into the community. It can range from $400,000 to $1 million. That's to get into the community, right? And then you have a monthly cost on top of that. But they offer lifetime care. And they have care starting at independent living, going all the way up to skilled nursing, right? Things to know about these continuing care retirement communities is that because they want to provide care for you for your entire lifetime and you never have to move again, they do a financial screening a lot of times because they want to make sure that you're not going to move in and have to move right out again, right? So you might have to pass a financial screening. The assisted living communities do not usually have that lengthy financial screening. You usually do not have to pay that big buy-in, right? It is a month-to-month situation. The assisted living communities have usually independent living, assisted living, memory care. Some have assisted plus, some have extended care. Some of these assisted living communities that don't promise lifetime care also have skilled nursing level of care, right? So they vary from program to program. How do I fund this type of care? Most people are privately paying for this type of care. Yeah, some are using their long-term care insurance. Unfortunately, Medicare does not cover these senior communities. We used to have a community on Oahu that accepted Medicaid, right? And that community was around for a long time, but it did close. It shut down. And to the best of my knowledge, there are no senior communities that are accepting long-term care Medicaid at this time. Which one is best for June? We're going to say that June's going to go into assisted living at this time, right? She's going to do a month-to-month, and June and Ichiro are going to move in together, right? They're going to use all the amenities of the community. Some have pools, some have fitness centers, some have hot tubs, libraries, beauty parlors, anything you can imagine. Some accept pets, some do not. Luckily for you guys, both communities here in Maui accept pets. So how many do we have? We have one assisted living community and we have one independent living community. And we have two experts coming to the panel from both communities to answer more questions. But yes. That's a good question. He said, what is the advantage to buy into a CCRC? Well, the CCRCs are owned by different companies, right? So they vary from program to program and they each have different benefits, but I'll name one of them for you so you can see the difference. One of the CCRCs has a foundation where they accept donations, and what they do is they promise that if you buy into this community and you run out of money, you will never become dependent on Medicaid. You will never have to move again. They use their foundation to pay for your care for the rest of your life. So that's one of the benefits to moving into a CCRC. But you have to pass a pretty heavy financial screening to get into these communities. They do have skilled nursing. Some of them have memory care. Some of them do not have memory care. And they vary, right? Some of them have different kinds of amenities. So, but they are very similar to assisted living, right? So some, a lot of people go to assisted living and they live there their whole lives, never having to move again, and they're getting their lifetime care from assisted living. So they're just foregoing that buy-in. So thank you for asking. Yes. Oh my gosh. Okay, how do I, home and community-based, adult residential care homes. Does anybody know how to get this back to the main with a clicker? Anybody tech savvy? That's correct. On Maui, we only have one assisted living community and one independent living community. No CCRCs here in Maui. Yes. That's a That's a good question. Dad, is that a scam? Just joking. So long-term care insurance does benefit a lot of people, but you have to consider the pros and cons, right? Not everyone can afford long-term care insurance. All the long-term care insurance policies have different stipulations, right? For example, we help hundreds of people that have long-term care insurance, and they can get the care that they need because they have the covered benefit. But we do help some people that can't use their long-term care insurance. I helped a gentleman that the only type of care that his long-term care insurance would cover was skilled nursing facilities. Now, the cost of skilled nursing facilities in the state of Hawaii are between $13,000 to $16,000 a month now, and his policy would only cover a few $100s a day. And so while he had the coverage, he could not afford the out-of-pocket expense that he had to pay to cover the difference. So he had a policy he had been paying for, and he couldn't afford to pay the copay. So you really have to read the policy. No, not if it's coming from AARP. You're in the right place. You should ask the experts here about that.
But you should make sure it's coming from AARP.
Yes, they said please make sure that it is coming from AARP.
Not somebody trying to fake it.
And yeah, thank you. Yes. Oh, good question. So there's no one size fits all. So when you're looking at a long-term care insurance policy, you have to consider many different things, right? What type of care would you want? Is it going to be covered under the policy? Do you want it for 3 years, for 5 years, 7 years, long-term? You have to call AARP to ask them about their policy and what it covers and inquire and make an informed decision and definitely call around because all the policies are a little different. Good question. You're correct. So she asked if long-term care insurance costs more if you start at age 75 versus starting at age 60. So the older you get, usually the higher the premium. Yeah. Thank you. Thank you.
AARP contracts with service providers. So you can get the service provider numbers in the resource room, but the staff that work in Hawaii and the volunteers work for the nonprofit side of AARP, so they can't answer specific questions about any products and services.
Thank you, Jackie. Thank you. Okay, so let's talk about the adult residential care homes. And again, I do not want to scare anyone today, right? A lot of people go into assisted living and they never have to move again. They stay there their entire life. So let's say that was the case for Ichiro, right? Jun and Ichiro went into the senior community. He stayed his entire life, and he unfortunately passed away in the community. And after Ichiro passed away, June started declining. Okay, she starts having multiple falls in her apartment. She's slowing down. Her dementia is progressing. She doesn't want to go to the cafeteria. She doesn't want to participate in any group activities. Her children are concerned about her, and they think maybe making a change might help her. So they want to look at a smaller environment. They're going to research these adult residential care homes. Some people call them arches. But what type of adult residential care home is best for June? The family does not know, right? They don't know that we have two types of adult residential care homes in the state of Hawaii. One is a type 1 and the other is a type 2. What does that mean? Type 1s are smaller care homes, right? They usually have about 5 residents, residents or less. The arch type 2s have 6 residents or more. So you can think of them as the larger care homes. So they're going to look for either a arch type 1 or a arch type 2, right? They're looking for a change in environment, right? Someone that can keep an eye on her around the clock, and they're going to start researching these different types of homes. They all provide supervision and care. They help with meals, chore services, transportation. They're going to take total care of June, right? And she's going to have activities there, opportunities for socialization. How does she fund this care? A lot of people are privately paying for their adult residential care home. Some are using long-term care insurance. Unfortunately, Medicare does not cover these licensed care homes, right? These are licensed by the Office of Healthcare Assurance. They're licensed and regulated. It's typically not a Medicaid benefit. Before the pandemic, I did see some expanded adult residential care homes accepting long-term care Medicaid. A lot of those caregivers were pioneers in the field. A lot of them retired. We do have a few sprinkled around that are still accepting Medicaid, but as our prices keep increasing, we're surpassing the amount that Medicaid reimburses these facilities. So a lot of them do not accept Medicaid anymore. And how many care homes do we have here in Maui? I think we have we have 8. We have 8 licensed care homes in Maui. Okay, I gotta speed through this, we're running out of time. We only have 8. So we have 2 expanded, which are higher level of care, and we have 6 arches, and one of the arches is a type 2. Community care foster family homes, we're gonna say that June is running out of money spending down her assets. She needs to transition to long-term care Medicaid. So we're gonna transition her to these community care foster family homes. That's a big time in people's life where I see them transition to these homes. These are smaller. They have basically 2 to 3 residents. Some people private pay, some people use long-term care insurance. A lot of people are using long-term care Medicaid to pay for this care. How many do we have in Maui? We have 55 in Maui. It seems like a lot, but if I had to guess, I think we have about 1,000 on Oahu. So we do have limited resources here on Maui. Last is the skilled nursing facilities. Let's say June has a significant medical event. She goes to the hospital. They recommend rehab. They want her to get skilled therapy, PT, OT, to get stronger, right? Before she goes back home to her community care foster family home, she's gonna go to the nursing facility for rehab. And how do I fund this? Medicare covers that. It's a Medicare benefit up to 100 days. You might need prior authorization. You might need to have 3 consecutive days in the hospital, but Medicare covers it. So let's say she does her rehab, she goes back home to the foster family. She's there for many, many years. She has another significant event. She goes to the hospital again. This time they're recommending end-of-life care. They recommend hospice. She stopped eating, she stopped drinking, she's very fragile, she's not getting in and out of bed. They're recommending her to go to the nursing facility for long-term care. Unfortunately, Medicare does not cover long-term care in a nursing facility. She's not getting skilled therapy. So, they're not going to be covering it, but not to worry. June transitioned to long-term care Medicaid in the community care foster family home. So long-term care Medicaid will pay for her stay in the skilled nursing facility if her level of care, if she meets the level of care requirement for that. So we got through all of our facilities in time, Jackie, and that's our brief overview, and now we're going to have a panel of experts to answer all your questions. Thank you so much. Thank you. Oh, okay. Yes. Thank you. Yes.
All the panelists are coming up. Can I buy your tape?
What tape?
Can you buy your spreadsheet? Because I lost.
Oh.
No way I could do that.
Oh, thank you. I think Jackie has all my slides, so she can give you all the slides, and I think they're recording it. I think they recorded this, and so yeah. Thank you. Thank you.
So we are, sorry, if you did register online, Nicole lets us send a PDF of her presentation out. So we'll send out.
Mahalo, Nicole. So we have our panelists, and we have actually 5 different folks, and basically the 2 folks will be speaking on home and community-based services, and then the other folks will be talking about housing options, independent living, assisted living, and nursing homes. So we have with us today, I'll mention their names and they can introduce themselves further, but Rowena Dagdag Andaya is the Maui County Executive with the Maui County Office of Aging. And Tanya Fernandez is the Chief Executive Officer of Ho'okele Home Care. Tim Johnston is the Senior Sales Representative, or the Senior Sales Representative at Kalama Heights Retirement Community. Debbie Priest is the Marketing and Community Relations Director at Roselani Place. And Wesley Lowe is the Chief Executive Officer at Halemakua Health Services. So please join me in welcoming them. And I'll pass the mic over to them and say they can introduce and start their session.
Good morning, everyone. My name is Rowena Dagdag Andaya, and I'm from the Maui County Office on Aging. And I'd like to thank AARP and congratulate them on a great morning of resources and information for all of you this morning. Some of you may have visited our table, our resource table in the cafeteria building and received this brochure. Before you leave today, I'd like to make sure that each one of you gets this brochure because it highlights the different services and the functions of the Maui County Office on Aging. If you have this brochure in front of you, you can follow along as I talk about what we do here at County of Maui. So the Maui County Office on Aging and the Aging and Disability Resource Center provides information, assistance, outreach, and services. Those are the 4 primary functions of our office. Our phone number is 808-270-7774, or inside the booklet or the brochure, there's a QR code. And you can scan this QR code with your phone. I can show you how to do that later today. And then be able to pull up all of our website And on that website, it gives you greater detail on our information, our mission, our values, eligibility criteria. It also gives an online resource database of the different services that are offered in the county of Maui. And there's also a page where you can request additional information or request additional information about our services. On our website, we also have some exercise and fitness videos and other resources on how to, on different events that are happening relating to aging on Maui. So when I talk about, I do actually want to mahalo Nicole for her presentation this morning. I thought that gave an excellent overview of the kinds of long-term care services that are provided in our communities. And she mentioned things about ADLs and IADLs, and it gets, I know there's a lot of information on that, but in order to receive services through the County Office on Aging, just like Nicole, oftentimes families or older adults call our office in times of crisis. But really, as an Aging and Disability Resource Center, anyone can call our office at any time to receive information about different topics relating to aging or long-term care. So you can be a caregiver and have questions about what types of services are available, not just for my loved one, but also for myself. We provide assistance to caregivers in terms of connecting them with counseling services, support groups, and also services such as respite care, which is what Nicole had gone over earlier. When people call our offices, oftentimes they're looking for assistance with different types of services. And in our brochure, on the right-hand side, there is a list of different services that we connect seniors with in the community. They range from adult daycare, assisted transportation, to chore, friendly visiting programs, homemaker. Legal aid is also another service that we connect seniors with. And these are services that are covered through different grants that we receive from the federal government through the Older Americans Act, from the state through a program called Kupuna Care. And we're also very fortunate at the County of Maui that the previous mayors and the county council have been supportive of our programs. So there are separate line items in the county budget that help support contracted services that we can provide in the community. We work with different providers such as Ho'okele, Hale Maha'olu. We also work with Maui Adult Daycare and Kaunoa Senior Services to provide all of these services in the community. Now, in order for kupuna and caregivers, well, mainly kupuna, to be eligible, they must meet the following requirements. They need to be a Hawaii resident who is at least 60 years or older, be a US citizen or a qualified alien, not live in an institution such as an assisted living facility, skilled nursing facility, or a foster care home, and have a functional impairment that prevents them from performing at least 2 activities of daily living or instrumental activities of daily living, such as eating, dressing, bathing, toileting, transferring, mobility. If they have impairments relating to that prevent them from preparing their own meals, shopping, managing finances, even taking medications, that's where we can provide assistance. The client also must not be receiving any services from another government agency or government service such as Medicaid, or be receiving private services. Now, earlier there were questions about Medicare and Medicaid, there are two organizations that we're connected with and on the state level. There's a state health insurance assistance program called SHIP, and they provide assistance in navigating through the Medicare system. We often get a lot of questions about what's Medicare, what are all of these things that I'm getting in the mail. And SHIP is a great program that you can contact. Later today, if you have questions about connecting with agencies that can help you with Medicare or fraud prevention, please come and see me or any of our specialists at the Office on Aging booth in the cafeteria. I saw that my green card was up and my time is up, but there's so much information. We'd love to assist you. Please get one of our brochures. Again, our number is 270-7774. Mahalo.
I'm going to test out this microphone for just a second. So just to let you guys know the format, each of these speakers is going to speak for 3 to 5 minutes, going to give you a broad overview of their organization, and then we're going to open it up to questions and answers from you guys directly to them. So that's our format. So she's not done, she's just paused. Respite.
Hi, good morning, everyone. I'm Tanya Fernandez. I am the CEO of Ho'okele Home Care. So we are a licensed home care agency. We provide services on the islands here on Maui, as well as Oahu. What home care is basically we send caregivers, typically they are nurse aides or certified nurse aides, into the homes of private individuals. So within these homes, they're methods. So the first method I call traditional, and it's traditional because this is kind of the model that most home care agencies use today. It is an hourly based model where our seniors are purchasing services anywhere from 4-hour visits up to 24-hour visits. And those visits are generally good for seniors who need constant care or supervision where they shouldn't really be left alone. So that's kind of the most common way home care is delivered. Another less common, newer way that home care is also being delivered today is what I call the task-based model. So in that instance, caregivers can come into the home and actually just perform a singular task, such as maybe just a shower or just a medication reminder. So for those seniors who really just need a little bit of care, whether it is once a week, up to maybe even 3 times a day, that model would be the best model to introduce home care into the seniors' lives, to help them, again, continue to live and age comfortably and safely within their home. Typically, as was presented so well earlier in the previous presentation, home care is primarily financed through private pay and/or long-term care insurance. However, there are fantastic organizations as well, such as the Maui County Office on Aging, the Veterans Administration, and various Medicaid programs as well, who also contract with agencies like ours to help provide those services as well. So thank you for having me. I'm happy to answer any home care questions for you.
Thank you very much for having me. Nicole, also great job. You crushed it. My name is Tim Johnston, and I'm here representing Kalama Heights Retirement Community. On the beach, independent living, 55 and up, and we're also age in place, meaning that if you can get the level of care you need, you can stay there as well. Kalama Heights is pretty all-inclusive living community. So we've got 1-bedrooms, studios, and 2-bedroom units. And included with your rent, you get 3 meals a day, chef-cooked meals a day, so you don't have to cook or clean anymore or shop. You get weekly housekeeping, Everybody gets a great call safety device. If there's an emergency, you can push the button, the operator comes on, and you can explain what kind of assistance you need. Maintenance is included, all the activities, parties, social events. We've got our own version of like Julie McCoy from the Love Boat, who puts together all the activities and stuff. So it makes it a lot of fun. It's also includes all your utilities, basic 50 cable. And so it's a great opportunity to just hit the easy button, sit back, relax, make a new circle of friends, and enjoy not having to do all the daily tasks of life. Also on property, we've got a heated hot tub and pool, an activity or a gym, and attached to it, we've got Venture Physical Therapy, as well as Hui Aloha, which provides adult care and services for people. So as you age, if you need help with medicine management, reminders, any of those sort of things, bathing, they can provide that too. As far as the rooms go, it's an initial 90-day lease, which then converts to a month-to-month lease after that. So it's a good opportunity if you're going to come in for a short-term or long-term. Our average stay is about 6 years. And thank you for having me.
I'll use this one instead. So thank you. My name is Debbie Priest. I'm the Marketing and Community Relations Director at Rosalani Place. We are currently Maui's only licensed assisted living and memory care community. We also offer independent living services and short stay respite services as well, all in the comfort of your own home. So it is apartment style living, similar to Kalama Heights in some respects. We do have, though, 2 registered nurses who take care of our staff, our medical staff, as well as resident aides who can assist with all of the activities of daily living that Nicole so eloquently spoke about earlier. So if our residents need assistance with dressing, bathing, help in the restroom, things of that sort, we have resident aides that can assist with that. And then we do check in on our residents every couple of hours, even throughout the evening, because they may need assistance if they have fallen or just don't feel well. They also have a call pendant that they can access to get immediate assistance. We also have a lot of fun activities and great food, restaurant-style dining, just a great place to call home. I've been working in this community for almost 8 years. We've been on Maui 22 years, and we are a nonprofit as well. So sorry, I get emotional when I talk about our residents and their families, because they bring a lot of joy to me, and I hope we're able to help them as well, too. So thank you.
Okay, guys, I'm the last one before lunch, I guess, as they call it. So I'm Wesley Lowe from Halemakua Health Services. I think many of you guys are familiar with that. So real quick, I know we want to get to the question and answers. Halemakua Health Services is one of, I guess I would call 2 providers of skilled nursing care and intermediate care. The other one is Kula Hospital. Now, Halemakua has 2 facilities, Kahului, which is our larger one, right in the middle of Kahului on Kaulana and La'au. Yeah, that's the big 252-bed facility there. And then we have actually one up in Wailuku, the 90-bed one, which is the old hospital decades ago. So not only do we provide skilled nursing and intermediate care, which I'm going to talk real briefly about the Medicare and Medicaid thing, but we also have the only, what Nicole calls a type 2 adult residential care home. That's a larger residential care home. Right now it's 18 beds, although we are probably going to convert some of the beds to long-term care to provide for the community and shrink that a little bit. We also provide home health services, which Nicole, again, eloquently talked about, is services, rehab services and nursing services for those homebound people in what they call an episode of care, usually 30 to 60 days. And then we have the only adult day health program, which people come in. We have about 35 people come in per day, and they come in from 8 till probably about 4:30. They are supervised by a nurse, social worker, dietitians, et cetera, during the day. We find that is really helpful for the community. And real quickly, the last thing that Well, before I go, so a lot of these services are not really services that you guys are going to look for. They're usually by referrals through physicians, and again, Nicole talked a little bit about there's financial and medical reasons to come to our facilities. We are trying to add, well, we just did add a new service. It's funded by the County of Maui through an AARP grant. We are piloting something called the Care Transition Services. And this is actually to transition you, if you do go into hospital, into the skilled nursing facility, into home health, and into home, and to manage your chronic disease 60 days post-discharge. So we're trialing it, and if we're lucky, we are talking to a couple healthcare insurance companies to hopefully fund that, because that's a needed service. I mean, how many of you guys remember discharge instructions after you've been drugged up for a few days in the hospital? So I think it's really important that we transition not only the patient, but the family into levels of care. That's basically it. I do want to just talk real quickly because I suspect there'll be questions. Medicare is a higher acuity services. Typically, Medicare average length of stay is about 20 to 25 days. It's sort of like a low-level hospital stay. It's trying to get you out of the hospital, et cetera. We have probably about 60 patients per day in our 2 facilities that are Medicare only. Some of those people, our goal is to try to get people home, believe it or not, even though we have lots of facilities. But those people that do not have the ability to go home, we do have Medicaid beds. And I know at some point in time, I think this group, you guys got to start thinking about Medicaid because there's something called a 5-year look-back period, and you need to make sure that you're aware of what it takes to get there, because what you don't want is to go into hospital, get your Medicare covered, and then all of a sudden, if you are not able to go home, that you don't have Medicaid. So there are companies that can help you qualify for Medicaid. You got to do it in advance because you don't have this 5-year look-back period. So if you have too much assets or income that you can't deal with it during that 5-year look-back period, it can delay you. Make sure I check with the expert here. Make sure I'm right. So anyway, I'll stop there. I know we want to get to questions and answers, but it's always great seeing all you folks. Thank you.
So mahalo, everyone, and we'll be walking around, and if you have a question, raise your hand. And if you know specifically who you want to direct the question to, just mention that as well. But there'll be 2 of us with mics, and we'll come around. So any questions?
So talking about the Maui Office on Aging, I've been there many times before COVID, before the pandemic. I think the director was Debbie, who is retired now, I believe.
She works in Washington, D.C.
Oh, okay. Well, Debbie referred me to another counselor, James, I think. Yeah, there. James Coe. He was really good, learned a little bit of sign language. But we talked about finance. Financial exploration. And that's under money management. It's a money management topic related to financial exploration. James was able to help me with an interpreter. It was wonderful working with him. But my problem, my father passed away when he was 80, had a lot of money, lived with a girlfriend. My sister, Poa, POA, was the power of attorney. specifically about financial exploration. Exploitation? Exploration? Exploitation.
Okay, so we just need a short question.
About money management. Listed on this handout. So unfortunately, my father's girlfriend got a lot of the money before kicking my father out. He came to live in my home. So I went to the Maui Office of Aging asking, saying I needed help. And there was no help provided. I asked for legal advice. There's financial exploitation. It was really just too late. The girlfriend had a love letter. It was gifted money. My sister was the power of attorney and asked where the letter was. To see the letter, there was nothing there. So, of course, he was taken advantage of. We were not able to get any help or any assistance with that situation. There was no help. There was money lost. That's all.
You ask your question after because it's specific to you and we have a short time period for the panelists.
Well, that's all I have.
Okay, I can help. Oh, before, yeah, I wanted to respond to that because in the past 2 years, we have been working with other agencies such as the Maui Police Department, the Prosecutor's Office, Adult Protective Services, and we created an elder justice team that addresses or discusses issues like this, where we see fraud or exploitation of an older adult. In the past 2 years, we've been able to convene regarding 10 different cases that sound very similar to your father's case. And so we're continuing to work on elder justice issues. I would hope that you are connected with legal aid services. That's another service that we provide through our office. So if yeah, so, okay, yeah, okay, thank you. Yeah. But I'll talk with you later, Mikey.
Can anyone address the issues around senior living, as in Hale Maha'olu system? So we applied a couple of years ago, and it has told us, or the reply is that we have a 10-year waiting list for any of the Hale Maha'olu centers. Can anyone address that issue?
Hale Maha'olu has a table in the resource room.
Great.
None of these people work for Hale Maha'olu.
Okay, I'll check that out. Thank you.
I'd like to talk to the Kalama Heights gentleman. It's a beautiful spot. I've had lunch there. Can you throw a number at us? How much a month? And are you a buy-in kind of organization?
So, like I said, it's an initial 90-day lease, and we have studios, 1 bedrooms, and 2 bedrooms, and the rooms are priced according to square footage. So within all 3 of those sizes, there's kind of like a small, medium, and large size. Based on that, I can give you roughly a range of price. Studios range in price between $3,700 and $4,200. 1 bedrooms are about $4,500 to $5,200, and 2 bedrooms are about $6,000 to $7,000.
I have a follow-up. So if people need some kind of financial aid to be able to I guess, apply or take advantage of that kind of housing, do you offer anything like that?
Unfortunately, we don't. We're private pay. I know there's VA assistance if you're a vet, and that's done on a case-per-case basis, but it is out of pocket.
Hello. I have a quick response to that as well, too. So with Rosalani Place, we're licensed for assisted living. So if you do have a long-term care policy, please review that, because most likely our licensed facility would be able to accommodate that. As Nicole is saying, though, you usually need to have assistance with 2 activities of daily living, so like dressing or bathing, before your insurance will help pay. And then as Tim was saying too, the VA has a pension benefit called Aid in Attendance, and that can also help supplement the cost of assisted living. So, thank you.
On the 3-month lease, do you have to pay the whole 3 months ahead of time? So is there a large fee right at the beginning at Kalama Heights?
No, you just pay it per month. Up front, there's 2 one-time fees. One is a $75 background check because it's community living. We just have to first make sure your mug's not hanging up in the post office. And then there's a one-time community fee as well, which varies just depending on the inventory. And more or less what that does is that just funds the maintenance, because when you move in, you don't have to do any maintenance, and when you move out, we restore the room back to rent-ready condition.
All right.
Two questions back there, then one up front after that.
Yeah, general question for the whole thing or Nicole.
Maybe some mic.
All right. The general question, Nicole went through all these different forms of aging in place and the different facilities and stuff, and mentioned there's 1 of this and 2 of those and 8 of these, et cetera, et cetera. Is there anything specifically about Maui that puts a name to these different kinds of housing options? Something that coordinates everything you were saying, but what is it here specifically on Maui that provides that service?
That's a really good question, and I'm not too sure. Is there, I think the Aging and Disability Resource Center with their No Wrong Door agency would be the best place to go to for Maui County.
That question that you have is a really good one. Having just like a dashboard of the different types of options available and the capacities, because all of that data is collected in different areas throughout the state with different state agencies. So unfortunately, we don't have a dashboard like that right now, but that's something that I know we're currently working on, creating a dashboard just for the services that we provide, but including that information on existing facilities and capacities, I think would be great.
I'm so sorry, I misspoke. All of the agencies that I talked about are licensed and regulated by the Office of Healthcare Assurance, which is a part of the Department of Health. So if you Google search Office of Healthcare Assurance vacancy listing, you can see a list of all of the agencies that I talked about. That's my go-to place to check whether agencies are licensed or not. The problem with that is that there are 1,200 facilities on the community care foster family list, and we literally have to search through all the different locations to find, the 55 Maui locations. So it's a whole directory of the entire state. So it is, sometimes hard to search through, but that's where you find them.
And the challenge too is that that list gets updated either quarterly or every 6 months. So it's not always going to be updated, but I can take that idea and bring it back to the State Executive Office on Aging to see, maybe if we can create some sort of dashboard that people can access, that might be helpful. Thank you.
This is, in my opinion, a very good overview of a lot of information on a lot of levels. Are there folks on Maui, and if so, who could actually sit down with an individual or a couple and kind of go through the knowledge and have a greater breadth and depth of knowledge than's presented here to help families prepare a plan, individualized, like you'd sit down with an attorney and go through an estate planning process? Are there folks you could sit down with an individual and go through kind of a life care planning process?
That's actually what my company does. We will sit down with you and we will read through your entire long-term care insurance policy to figure out what the barriers are and when you can use it and what types of care it covers and things like that. And we can help explain, if you get denied from Medicaid, you should contact the MedQuest office, but some people get denied over and over and they just don't understand what's going on. So try to be a support resource for that. I'm not supposed to, yeah.
So the panel is supposed to be representative, and we're not really supposed to promote specific companies. But I'm going to be sending you her presentation, which has the name of her company, so you could let your fingers do the walking. But question for Rowena, are there other care coordination companies working on Maui? And how would people find out who they are?
Yes, you can call our office and we can connect you, or you can go to our website and access the resource directory there. We also have a handbook, a resource directory handbook provided through our office, and we have copies of them. So please visit our table, get our brochure, get all of our resources, and you'll find the number and the names of the organizations that can help you with those questions that you have. You can also call our office for those kinds of questions as well.
So we have a question right over here.
Yes, for the gentleman in the Kalama Heights, Tim, I presume that those are single-person quotes that you were using for range of value. Is there a supplement cost for two people fitting in one of those leases?
Yes, there is. It's an additional $825 for a second person, which initially just covers your food, utilities, housekeeping, all the daily expenses.
Thank you.
Any other questions?
Hello,
Hi, Nicole, you
my
mentioned.
name is Vesta. Oh,
I have a question for Nicole. So you mentioned long-term Medicare. I was familiar with most other things you mentioned, but I wasn't clear what long-term Medicare means.
Oh, long-term Medicaid, long-term care
Okay,
Medicaid.
thank you. That
Yes.
clarifies it. Thank you.
Yes.
hooray, finally. So hi, my name is Vesta. So I live here on Maui. So the two of us, as we were driving past Hina Avenue, passing by the elementary school around there. Passing by Wake Avenue. In that area, there was a senior living, Hale Maha'olu. We were driving past, we were seeing it looked to be vacant. And for a long time, it didn't seem like there were any move-ins. And it seemed sad. Oh, why would they make a senior living center? No one's moving in and the wait list is so long, 10, 15 years. How come there aren't more people moving in that we've noticed?
So nobody here represents Hale Maha'olu, but they have a table in the resource room, so you could ask them.
Also, I think that if I'm remembering the description, I think Catholic Charities is developing something in that area that is going to be, it's not ready for occupancy is my understanding. And I believe Hale Maha'olu was going to manage it, I thought. Isn't that Catholic Charities down by Christ? I think you're right. Yeah. So it's not, that one might not be done because I think the other person said Hale Maha'olu is, the existing Hale Maha'olu are all full. Oh, there are some under renovation too. Okay.
More questions? Are we done? So you can always ask one-on-one questions of the panelists after. We have about 10 minutes where they could be here for questions. Our next session is going to be we're going to have Meg Obanoff here talking about estate planning. So we had mentioned maybe the need to talk to an attorney. We will have an attorney here, but again, it's not for specific questions about your own situation. It's general education. We will have a 15-minute break if you want to get snacks and visit the resource tables. And if you have specific questions that you want to ask one of the panelists, I'm just going to ask you to walk up and ask your question, yeah? So thank you so much, and thanks to our panelists. Give them a round of applause. Okay. Oh, and if you stop by the Maui County Office on Aging table or the AARP table, we can show you how to use a QR code. It's our big new thing, too. Can you guys hang out for just a couple minutes in case people have questions? So